Nasal polyps are a condition we see in patients who have long-term allergies. They usually come into our office stating that they have had progressive problems with pressure in the nose, congestion in the nose, and blockage in the nose, despite attempts to treat this medically. When we look up into the nose and get an x-ray, we'll see growths that look like grapes. And these growths are actually the lining of the sinuses. They get very swollen and they form these masses that physically block the sinuses and block the airflow through the nose. When we see a patient with polyps, the first line of treatment is medical management. We find out what it is that caused the polyps, and this often involves getting allergy tests to see what it is that the patient was allergic to that caused it in the first place. We try environmental control. Sometimes we try immunotherapy to build up the patient's tolerance to whatever it is in the environment that caused the polyps to form. And then ultimately, if they're still there and still causing symptoms, we remove the polyps. Removing the polyps has come a long way in the past 3 decades. At one point in time, we had to physically cut into the sinus, remove the sinus, and remove the offending polyps. Now, this procedure is done with a minimally invasive technique. In the office, we literally suck the polyps out. We will do a balloon sinuplasty to open up the sinus if we have to actually go into the sinus to get the polyps out. And then we leave little implants in the openings of the sinus to try to prevent the polyps from coming back. Our success rate in removal and keeping polyps removed is about 90%, which is pretty high and is higher than it used to be when we were doing pretty major surgeries for polyps. Sometimes we'll see patients who have had polyps done the old way, and they come back into the office very concerned that their polyps are back because they are having problems breathing again, and indeed their polyps have returned after a number of years. And they're so relieved to hear that now we have an amazing procedure called the computer-assisted balloon sinuplasty with removal of polyps that we do in the office that takes maybe 20 to 30 minutes in the office. It is done with computer guidance where we literally suction the polyps out of the sinuses and out of the nose. The patients have minimal downtime from this, maybe 1 to 2 days, and they're thrilled to go through this experience compared to what they had gone through before. So there's no reason to be overly concerned if you had polyps removed 10, 20, 30 years ago and now they're back, because it's gotten a lot easier.